provide supported living services and residential services across the UK, from down in Plymouth all the way up to Inverness. We support in the range of 6,000 people, and we employ approximately 9,000 staff, working in both supported living services. We've got two supported living divisions. We've got supported living north and supported living south, and we've also got a complex care and autism residential division, supporting people with more complex needs in residential services. I suppose really one of the main reasons why iPlanet is the interface for both the people we support and our employees. You can involve the person we support in developing their plan by using multimedia guidance. They've got their own profile that they can look at, which links into the staff side of things. So I suppose it really is person-centred in the way that it can be utilised in services, and also from a point of view as an organisation like Lifeways, because we are a large organisation, we have developed our own sort of bespoke systems and processes over the years, and to bring in a system and process which kind of is forced onto us almost. We have to work in a certain way with that system. Really probably won't work with us, whereas iPlanet has been great because we've been able to tailor the system to look how we want it to work, how we want it to work. That across the sector at the moment, we are getting asked quite a lot to how do we evidence outcomes, and we do evidence outcomes. We evidence outcomes really well on a paper-based system. What the paper-based system doesn't do for us then is collate up throughout the organisation as to how we're doing against outcomes on a area, regional and national level as well. So being able to utilise that functionality of iPlanet and having a dashboard that will show us how we're performing against outcomes is really, really useful. I think really key both for the people we support and for our commissioners as well. You know, we have talked about do we need to do a training session for the people we support on how to use iPlanet, which could be quite formal, whereas actually when you do look at the interface with the people we support, it's relatively straightforward. It's like using a Facebook or a sort of social media. So we think perhaps an informal approach to training people will be the best way of actually sitting there with the tablet devices once they're in the services, going through their plans and how to use iPlanet. When we started the project group originally, I started off with the operational managers initially, but then it became clear that we needed to involve other departments if we're going to make iPlanet succeed. So our workforce development department have been really involved in the whole iPlanet process, from start in terms of how it's looked, through to then developing the pilot training package that we've developed. When we developed the training package, we wanted to make sure that the pilot was not too over ambitious really, so that if we were picking up any learning issues for the managers, we could support them both through formal training, also informally with some more sort of breakout sessions. And really the objectives that group set were that the service can become paperless, and that iPlanet could do everything for us from assessment, support planning, through to writing daily notes, managing the diaries for the people we support, all of those areas, as well as being a good communication link for the people we support as well, in terms of being able to send messages to managers and all those functionalities that iPlanet brings. Currently trialling some tablet devices within the services so that the support workers will be able to use the tablet with the people we support and actually input into iPlanet, add media if needed, and also to allow the person we support to use that device to add to iPlanet as well. We might have somebody who say has got a quite detailed eating and drinking plan, or an epilepsy management plan, whereas we would have the support plan that says this is how the staff need to manage this, and also see the local authority or healthcare professionals plan. Now with iPlanet, we're just link it straight in. So we were looking with one of the service managers the other day at their support plan, and they put a line in the plan saying, please see my eating and drinking guidance. You just clicked on it and the document opened up and it was there, and with information it was just easy to access. We've been able to monitor the quality of information that's in somebody's plan, to be able to see how involved that person is within their plan and how tailored that service is to that person's needs. The use of messages as well is something that we talked about quite a bit during the pilot. The people we support can message their manager directly. And in terms of tracking reviews as well, and that's a really important one, that maybe you're able to set review dates and have reminders come through when those review dates are due. The plan is to roll it out across the 3 schemes that we've identified, so that the staff members will be using the daily notes and recording against the outcomes. The managers who have already created some support plans will then start creating support plans for other people within those fact-based schemes. But as I said, we're already finding some sort of innovation within the way it's being used, and some of our managers are asking really pertinent questions that really make iPlanet quite exciting in terms of how it can be used. Yes, I would actually, and I think the main reason I recommend it to other providers is because you do get a very flexible approach. We haven't had to compromise, and I think that's something that's quite unique. That it's not an off-the-shelf system. That actually we're influencing the functionality, how it looks, how we can use it, and how it fits with our systems and processes.